In hospitals compete for U.S. nurses as coronavirus case surges, authored by Tammy Weber by the Washington Post. Quote, but the departments are not surprised, according to experts, concerning not only mental toll, but the fact that many nurses trained in acute care are over 50 and increase of risk complication if they contract COVID-19, while young nurses are often having children and other families to worry about. We know such statistics. I butchered that. I'm very sorry. Yet, why is it that we can't protect people? Why isn't the CEO protecting the root problem? Why isn't he fixing the root problem? If nurses get sick, patient gets sick, yet the CEO knows that the more patients that he has, the more money that he will obtain, since there's no national Medicare for everybody. Yeah, just my opinion. I won't use that on the research topic. Anyways, same quote, no, same author and same magazine or news outlet. At one point in mid-October, 215 staffs were in isolation after showing symptoms of being exposed to some who tested positive and some who are starting to return to work. Why? I know PPE is scarce, but I feel that one reason is that we made too many inflammations, inflammatory and respiratory breathing things because of what Donald Trump did. Um, why didn't he create PPE? He knew PPE. He knew that Dr. Fauci wanted more N95 masks, so that masks needed to be more. So it wasn't. So basically, Donald Trump knew that N95 masks were pretty incredible and could save a lot of lives. Yet he created respiratory devices rather than PPE for the nurses or for the citizens. Why didn't you think of the citizens? He only cared about the COVID patients. He only cared about the people that were hurting. Yet he didn't take us in effect. He didn't take us, we the people of America, in effect that we weren't that important. And he just wanted us to suffer. That's just my opinion. So take it with a grain of salt. Anyways, in California, new nursing homes now require to staff for infection prevention and control by Maria Setiel, published by the U.S. Today. Quote, but they were excluded from an existing law that required health facilities to report adverse events, including specific patients' death, to the public health department within 24 hours. So basically, what this quote was, it's basically in the middle quote, but basically, nurses that were like infected, they were excluded by a law, and within 24 hours. So why is it that I don't want to say questions? It's just this is messed up. Why? We need humanity to pull us together. Yet we're so divided. It's not because of Donald Trump. It's because we, as in everybody in the United States, doesn't want to cooperate. One side doesn't want to wear a mask, the other side wants to wear a mask and have a national lockdown. One doesn't. So where's it gonna go? I think we're going to a civil war pretty soon, but I don't want death around me again. Anyways, Allied Times. In Hollywood, Presbyterian Medical Center fined after nurse dies of COVID-19 by Somia Kalamangia. I butchered the title and news outlet Los Angeles Times. The quote says, because the floor wasn't primarily for COVID-19 patients, N95 masks weren't regular given to staff and instead preserved for those exclusively treatment patients, as staff says. So basically what this quote is trying to say is that when the patient died, the staff, the CEO, the head honcho, basically said, no, you don't deserve any N95 mask. No one deserves an N95 mask unless they're fighting or with a patient with COVID. And for me, yeah, it's scarce, but everybody should be treated equal. If you're not going to give N95 masks to, like, a nurse, I firmly believe that you should have fired her for her own safety. Yet, I don't know why you needed her in the same building with infected people and doesn't have the required PPE to protect herself. It's very frustrating to me that many nurses are dying. Yes, mental health is a very big problem with this, but I feel that personally, everybody can get over that mental struggle, but not protecting yourself, not protecting a human life I see in my eyes as a sin, because you don't value that human's life than the other person 2 floors above or 3 floors above, or even a patient. You just see them as an ant in your big money scheming or in your hospital. It's not fair. Finally, in doctor says this will be the worst surge yet, from treatment to testing to PPE. Is the U.S. better at handling COVID-19 now? By Holly Yan, news outlet CNN Health. So the quote says, Dr. Megan Ryan says this, we're heading similar stories from my colleagues, literally across the country, including here in the Northeast, Oregon. I'm gonna say Oregon. We're starting to see hospitalization tick up. We're seeing people who are much sicker than they have been since that first wave in the Northeast in the spring. So, to me, this is a huge warning. We need a national mandate. But if the people don't want, but what if the people? So let's say a scenario. What if someone doesn't want to follow it? Well, I firmly believe we just throw them in jail. Throw them in jail, give them food and water, give them clothes, let them have a shower at the YMCA or a public gym, and then wait. They have to stay in jail until the lockdown is done, or if the cops and the arrested citizen has an agreement saying, like, I won't do this again. Okay, that's cool. Also, my second opinion, I kind of like this quote. This kind of scares me. If it's from the Northeast and we can't contain this virus yet, and and the line is basically going this way, how are we supposed to protect ourselves? Do we wait until next year? I don't know. So personally, me, just don't go out until we have a national mandate, and until that national mandate lockdown is over, that's when I'll probably finally start going out and start working out. Yeah, I grew a little bit of a chin. Yeah, I'm gonna get rid of that. Yeah, but anyways, as I always say, take it with a grain of salt. Bye.